There is a difference of opinion tonight on just how far nearly $200 million in funding will go that Pennsylvania will get through the Rural Healthcare Transformation Program. The funding does not replace all of the cuts made in the Republican One Big Beautiful Bill Act. 2822's Colby Hughes is following the story for us tonight. Colby.
Mark, I spoke with Congressman Rob Bresnahan as well as Scranton Mayor Paige Cognetti, who is running against him this year. They discussed what this funding means for northeastern Pennsylvania and what Pennsylvanians will get out of it.
At a roundtable discussion Friday, President Trump discussed the Rural Health Care Transformation Program. 8th District Congressman Rob Bresnahan was there, talking about the importance of keeping rural Pennsylvania health care funded.
The Rural Transformation Fund will be used not just to plug budgetary holes inside of operating costs, it's truly to reform health care and make it reliable.
Congressman Bresnahan says this will allow them to implement AI technologies to, quote, be able to have better quality care for the people of northeastern Pennsylvania. Among the facilities he is focused on are Scranton's Moses Taylor and regional hospitals, which have been in a precarious position.
We pledge to be as supportive as we can on the federal level as community health systems transitions to the possibility of Tenor taking over the hospital system. You know, there's some good momentum coming out that we are cautiously optimistic that they are very close to a deal.
Across the aisle, Democratic Scranton Mayor Paige Cognetti says the work for Moses Taylor and regional hospitals to get a buyer has been a years-long process. She says a lot of reform is needed.
But the dollars are hard. It is a lot of money to run a hospital, and we are sadly kind of at the nadir of private investment taking over healthcare systems in America.
When it comes to the funding from the Rural Healthcare Transformation Program, she says it is not enough to make up for the cuts done in the One Big Beautiful Bill.
The healthcare cuts are steep, and they are already changing the way that hospitals make their projections. They're changing the way nursing homes are making their projections, in addition, of course, to the way that households, seniors, Meals on Wheels are making their projections.
While the results of this program remain to be seen, the focus is sharpening on the local healthcare scene.
We need more healthcare, not less. We always need to be planning for the worst while also making an environment for development.
Rural healthcare, rural clinics, rural hospitals are the backbone of northeastern Pennsylvania.
Congressman Bresnahan believes these funds will be handed out by the end of March. In the studio, Colby Hughes, 2822 News. Back to you.
Colby, thanks.